Hello everyone, I'm John Salmanton Garcia, postdoctoral researcher from the University of Cologne in Germany, and today I want to share with you this publication regarding the access to diagnostic and treatment from or for invasive fungal infections in Peru, which has the title of Fungi Under Fire: Addressing a Peruvian Health Challenge. Invasive fungal infections are a significant global threat, and they affect an estimated number of 7 million people annually, with around 50% of population or mortality rate. In the case of Peru, IFIs are estimated to affect about 2% of the population. And there is actually a problem with the diagnosis. I mean, under diagnosis is a problem in Peru due to limited sensitivity of diagnostic tests used, which underestimate the true burden of invasive fungal infections. With this publication, we wanted to evaluate the diagnostic capabilities of mycology laboratories and the availability of antifungal treatments in Peruvian healthcare facilities to identify gaps and improve the invasive fungal infection management. We designed a survey that was provided nationally between April 2023 and April 2024. This survey was reviewed by national expert institutions, and data were validated and analyzed descriptively. The data collected were focusing on frequency of invasive fungal infections in the respective institutions, also the availability of diagnostic tools, the laboratory workflows and culture methods, and the access to antifungal drugs and imaging. We had 40 or 54 centers participating, the ones that are in the map colored in red, from 21 of the 24 departments, which is the name for regions in Peru. The participating institutions are marked with a white dot. Regarding the pathogens perceived as most relevant, similarly to research in other countries, the most concerning pathogen was Candida species. Almost all the participants consider it the most worrisome pathogens. Afterwards, Aspergillus and Cryptococcus, both of them almost at 60%. And then Histoplasma, a bit more than 20%, Mucorales, 20%, and then we would have Sporothrix, Hyphomycetes, and Fusarium. Regarding diagnostic tools, all the institutions had access to microscopy. Almost all the institutions, around 90%, had access to culture. And if we speak about antibody detection, antigen detection, or PCR, we observe that these techniques are available only in a maximum of 50% of the institutions. This is the case, 50% of access for antigen detection, 30% for antibody detection, and 20% for PCR. And finally, access to antifungals and also therapeutic drug monitoring. There was a global access to fluconazole, and afterwards to at least one formulation of amphotericin B, around 90%, and mainly, unfortunately, amphotericin B deoxycholate. The access to lipid complex or liposomal formulations was quite rare. Only 40% of the institutions had access to at least one echinocandin, mainly caspofungin, and following and resuming the access to triazoles, the mold active, or focusing on the mold active triazoles, the most frequent one was itraconazole at almost 80% of the institutions, and afterwards voriconazole. There was no center with access to flucytosine, and the access to terbinafine was possible in 30% of the institutions. There were very few institutions that could perform therapeutic drug monitoring, and if this was the case, it was possible only for posaconazole and voriconazole. So with this, we have one study that highlights the disparities in the availability and advanced diagnostics and antifungals in Peru. Also, despite universal use of microscopy, access to species identification, antibody and antigen detection tests is limited outside the capital. If you read the manuscript, you will observe how we have performed some comparisons depending on the severity of patients admitted in the different hospitals and also on the urban versus rural areas. And finally, and probably the most important conclusion is that ensuring equitable access to resources regarding diagnostic and treatment in invasive fungal infections and implementation of therapeutic drug monitoring are crucial for improving the management of invasive mycosis in Peru. Thank you very much and see you in the next video.